Hey, let's talk about the 7 rights of immunization administration. So, number 1, the right patient. So, how do we ensure we're giving the vaccine to the right patient? We're going to verify the order with the patient by using 2 patient identifiers, such as name and date of birth. Number 2, the right time. Sometimes vaccines are not administered according to the U.S. immunization schedule, such as on here it tells you how much time you have to give in between each vaccine, and we don't want to give them too early, so you want to make sure that that's the correct interval in between. Number 3, the right vaccine and diluent. Errors have occurred administering the wrong vaccine to a patient, so check the vial 3 times before giving the vaccine and the diluent to make sure that the diluent is the liquid that, so some vaccines are powders and they need to be mixed with a liquid to turn the powder into a liquid before giving it. And so there's certain diluents that go with the powder. Always check the expiration date of the diluent or the vaccine, or if it's a pre-drawn syringe, always check and make sure that it's not expired. Number 4, the right dosage. Errors have been made giving a wrong amount of a vaccine to a person. So there are some vaccines that are pediatric only or adult only, and you want to make sure that you're giving the right one. Number 5, the right route, needle, and technique. Errors are often made administering vaccines using the wrong route, needle, or technique. Be sure you know the appropriate route of administration. We have vaccines that are given orally, intranasally, sub-Q into the fat, or intramuscularly into the arm. So we need to make sure that we're using the correct one. If you were just hired, you are going through just the immunizations that are given into the deltoid of adults. So this is the only spot that you'll be giving vaccines until your next training. And most likely you will be using a 1-inch needle. That's the length of the needle. Okay. But there is a piece of paper in the bedroom that will verify the patient's weight and the correct needle size that you'll be using. Number 6, the right injection site. So, like I said, you will be giving it in the deltoid, in the muscle. Number 7, the right documentation. It's best to follow federal law and fully document each administration in your patient's chart. Be sure to include the vaccine manufacturer, the lot number, the date of vaccine administration, and the date, the printed VIS. So the VIS, the vaccine information sheet, needs to be given every single time you give it an immunization. And we need to document that we gave this in our system. And so we do most of this documentation even before we give it to ensure that we are doing our 7 rights. And then after we give it, we will document which side we gave it on and how well they tolerated it. This is also our opportunity to ask the patient screening questions to make sure that they are getting the vaccine in the safest manner, since there are contraindications to getting vaccines. So again, this is our way of preventing immunization errors, and this is something that we need to do every single time before we give an immunization. Right patient, right time, right vaccine and diluent, right dosage, right route, needle, and technique, right injection site, and right documentation. Thanks.